All right, welcome to another episode of the Athletic Transformation Project podcast. Today I am joined by Chris Williams, a head athletic trainer, kind of wears many hats at Monte Verde, a very kind of unique, technically high school. We were kind of just joking about it before we got on here, but a very kind of high level high school sports program that does a lot of very unique things. So I'm very interested in Chris's kind of experience as well as the role that he has at this place at Montverde, because like I said, they do a lot of very unique things from a sports performance side of things, from a athletic development side of things, and so very excited to see how that kind of chop up how that works with the integration with school and younger kids and all of that stuff. So Chris, welcome to the show.
Thank you. Glad to be here.
Yeah, absolutely, man. So I know we were just chatting before we jumped on, but maybe if you wanted to kind of just run us down how you got into Montverde real quick, and then can kind of get into like what's maybe unique about that compared to some of the other places that you've been before.
Okay, cool. So I graduated from UCF. I've been very advocating into athletic training. I love athletic training, all the different hats it has. Uh, I love I love helping people. Athletic training is a field where you go from basically you see a kid, a patient zero, and then you get to see them back on the field doing what they love, playing their sport. Um, I went from UCF. I graduated there in 2017. I went to Louisiana Tech and got my sports performance degree, and also was able to work with the volleyball team. Learned a lot about upper body mechanics and just different injuries that you see in the Division One setting from a volleyball standpoint. From there, I went to UAB, the University of Alabama Birmingham, to work football. I grew up playing football. I love football, and I loved working it. It's a grind. It's a grind working the whole college football season. Um, but it's rewarding when you get to see the kids go back from injury and then getting back and playing the sport that they love. From there, I moved back to Florida to work at Stetson University for about a year and a half. I worked the softball team, the volleyball team, and the cross country team. So it was many different sports. Got to see all sorts of different injuries, and then basically I was ready to get out of the college setting. College setting, I love the college setting, but the work life balance can be tough. And Mount Verde had an opening, and I was able to get that opening and start to work with many different athletes at Mount Verde. It's changed a lot in my now third year going into it. Originally, we were working where everyone was working different sports, and now we've had the ability where we've been able to have people designated to each sport. So I'm the head athletic trainer for the basketball development program, and I get to work with the kids that are sixth grader that's learning how to play basketball, just learned how to tie a shoe and dribble the ball, to the kid who's 6'10", number one kid in the country, and it's probably going to be in the NBA in 3 years or whatever it may be. Um, so it's a great thing that you get to see the different levels, and then also you get to see the elite level. You get to see what's the difference between the elite level and the lower levels. Uh, and it's funny because the elite level may do something that the lower level can do or can't do something. Like for instance, like their ankle mobility or something may be awful, but the little kid can bend his ankle all the way.
Mm,
It's
interesting.
just interesting to see the different differences like that.
Yeah. So talk to me about Montverde a little bit more specifically, because I know like for people that maybe outside of the Orlando area, maybe not be as familiar with it. Like it is like if you hear like a high school, people have a very probably different like impression of what this place actually is. Like this place is border like almost like a factory for athletes. Like you guys, I know bring a lot of people in from like overseas and stuff like that too. Like very, very high level sports programs that you have going on there. So you can maybe just talk about some of the differences between like what is different about this place compared to like your typical high school down the road.
So the big thing is we have borders. We have kids, like you said, from outside the country. I'm pretty sure it's 96 this year. Different countries are represented at Mount Bird this year. Um, Honestly, the biggest difference, what I've noticed, is all the athletes want to compete. So, like for instance, you have a kid from, let's say, Brazil, and then you have a kid from Orlando. Let's say Orlando, a local kid. Um, Both of them might be the top of their class or athletically, and then all of a sudden they're on the same team and they're not the top anymore. Um, at Mount Verde, everyone's competing. kids all want to get better. Every single kid wants to get better. Like I said, those little sixth graders that just learn how to dribble, they're actually trying to get better, right? They're trying to learn how to dribble. They're trying to play basketball. They may have the aspirations to be in the NBA. Maybe it happens, maybe it doesn't. But the kid is there to work towards that to get better. Like I was saying.
That's awesome. So yeah, it does seem like it's just a much higher level of training, but also like you said, from the athlete side of thing as well. Like they're bringing more to the table than like your typical high school athlete in terms of their drive, their focus, like what it is they're trying to achieve. And I'm sure like based off of the reputation that Montverde probably has now, like they're attracting kids like that to kind of really build that environment a little bit.
Yeah, basically from 7:30 in the morning till 6 o'clock at night, a team is going.
Wow.
Um, some if it's soccer, if it's basketball, all different teams are training at different times, trying to obviously get better at their craft.
That's awesome. Like, and so then they start from a younger age, right? Like this is like they start with like middle school as well. Like you talked about the sixth graders, or how does that work with the integration with the high school?
So we have our middle school teams, and then we have like if you're in the academies, like I was stating, the SEMA Academy and the CBD Academy, um, they'll be in the CBD Academy, but they're a middle schooler, so they're doing the same training as maybe a 10th grader, but they're learning at a younger age.
Got you. That's very, very cool. Okay. And then what does some of their like kind of like day in the life for some of these younger kids? Like obviously they have classes and stuff like that, but I guess especially for the boarders in particular, like you have the ability to like maybe integrate the team like training and school in the way that you don't necessarily have with when you have club sports that are separated from like the high school classes.
So let me think about this. So usually the younger kids are more in the afternoon. They have their classes in the morning, and then in the afternoon they have their training time, and that usually is from 1 to 3:30 or so. And they're just working on basketball. At this time of the year, it's more just pickup. The seasons are over. They've had their seasons over. They're more working on their skill development, and then they'll play a little pickup. Uh, the older kids, usually the high school kids, are training in the morning, and then their classes are in the afternoon. So it's a little flip flop, but they're always working on their skill in some standpoint. If it's for instance the CBD program, we do Monday, Wednesday, Fridays, skill development for about an hour. They do dribbling in place, shooting drills for about an hour, and then they move on to whatever they're planned on for the rest of the day.
Got you. Got you. That's very cool. Okay. And then so you talked about like one of the benefits from your perspective is being able to like see some of these kids that are literally just getting started versus some of these kids that, like you said, are some of like the best in the country at their age group, at their position and different things like that. Like what maybe are some of those like differences you see like between the two? Like you talked about the some of them maybe being a little bit more counterintuitive, like the better guys maybe having less like ankle mobility, just different things that you would expect that some of these higher level guys to have? Like, what are some of those big differentiators?
Uh, Differentiator, I think is most of the time it's natural talent. Unfortunately, but there are those kids. There's a few kids like being going in my third year. You can see the difference now. So we have kids that like when they first came in couldn't dribble with their left hand, and now like he looks like he's left-handed. Like we have I don't want to say names, but we have kids that there was kids that was like, oh, I can beat you 1-on-1, and then now it's like, oh, you have progressed so much, you were so much better now that I'm like, oh, you are like you're way better. You could go play at another high school and be the star of a high school, but you're here getting better because you're playing against people who are either the same thing, the top at another high school, or you just want to learn from these coaches who have a vast knowledge of just basketball, basically.
That's really cool. And I know maybe kind of getting a little bit out of your wheelhouse, like getting into more of like the actual skill development side of things.
Yeah.
Mm. But it seems like that's something that's actually kind of rare. Like that ability to like develop talent and develop players is something that I feel like you don't see a lot of across many sports in many different areas. Like it is a lot of times just relying on natural talent. Like the kids that are the best can carry a team. Like you don't see a lot of those real like transformations, that development, that like eyebrow raising of like, oh, I saw this kid 2 years ago and he's a completely different like player now. Like so that's one of the things that I mean, I'm sure you and I, like in our role, like that's the kind of stuff that we get excited about. So I know again, like getting a little bit more into the skill development side of things versus like our wheelhouse with the physical training, the physical prep. But like what are some of the what are you guys able to do that allows that to happen? Is it just the higher intensity of the environment, just higher level of coaches, like a little bit of everything? Like,
Really think it's a little bit of everything. We're totally unique where we have a little bit of everything. Um, and our like we have a great just athletic administration. They allow for those coaches to do what they want to do. And like for instance, like hopefully we'll be expanding with our athletic training room. But our strength, we have a great strength training room. Um, we actually have two weight rooms. And we have a turf, we have an outdoor turf, all sorts of stuff that can help push the physical component of your ability. Um, like I was saying, those guys who are natural talent, maybe they can only bench 120 pounds. We have the ability to help them, get stronger, and then that leads to them being better in, like, let's say it's a tall kid, skinny. He was able to get stronger, then now he has a post game. He's already naturally one of the best players in the country, but now he has a post game because he's got some strength to him. He's not scared to go defend somebody, or he's not scared to go into the paint and actually score. That's something that's nice to see. I know when I played football in high school, and we had a weight room, but we had what we had, like some bench, some power clean, but we have jump mats. We have a Kaiser unit. I don't know if you're familiar with that, the air pressure. Um, oh man, I feel like I'm blanking out on it. We have, sleds. We have all sorts of stuff. We just got, for the athletic training standpoint, we have a diagnostic ultrasound, so that'll help us tell with soft tissue injuries, with acute stuff, kind of tell where the tear is if there is one. Um, we also have BFR, which is fantastic for rehab, especially post-surgical rehab, what I've seen. And then obviously we have recovery modalities, stuff that maybe other high schools don't have the ability to have.
yeah, yeah, for sure. I mean, it does seem like the facilities and stuff like that that you guys have there is second to none to a certain extent. So that is really, really cool. And then for you, like you're starting to kind of wear multiple hats as well, right? Like you're kind of blending the role between like rehab as well as also doing a little bit more of the sports performance side of things. So like what is your role kind of turning into exactly? Are you working like in hand with a strength coach? Are you doing like the sports performance strength and conditioning side of things? Like how is that working?
So it's more in hand. Us as athletic trainers, we work with the strength staff. Um, Big thing that I do is I do a overhead squat analysis, just to see with guys. So, like for instance, 6'9" guy, real tall, lanky. What I do is the overhead squat analysis because I want to see, can his ankles move, can his hips move. He's been having knee pain all season. So why is that? Why do we have that all season? Obviously, he's jumping out of the gym. Let's say he's jumping out of the gym. He's jumping every single day. He's been playing since October, and right now is AAU season, so he's still playing. So can't really take that away because he's always going to play basketball. But just try to see what the factors are and why he's having this knee pain and how we can reduce it. And then also, maybe if we reduce it, maybe he's better on the court now because he's not having that pain anymore. Maybe he was restricted all season because of that pain. Obviously, during the season, it's more of a management standpoint. You can't fix things in season. It's always kind of just, we got to keep it going. You know, if it's as bad that you sit out, then you sit out. I mean, that's the body calls for that. That's what it calls for. But just trying to see where we can reduce the pain, increase maybe mobility, like you were saying, with hip mobility, hip and ankle mobility, that'll relieve the knee pain. And so just stuff like that, working hand in hand with the strength staff. Um, they have their program for the whole year, the whole calendar year of what they want to do with the little kids, the varsity guys, the high school guys, and then just kind of working with them about, if there is acute injury, letting them know, like, okay, it's their left hand. Okay, they can't lift with their left hand, but they could do stuff with their right hand. They could do stuff with their legs still, kind of working hand to hand with that so that we can maximize, but also give the kid the best opportunity to excel.
Got you. So yeah, like really, like you said, that integration piece I do think is really, really big and probably something that it sounds like you guys do even better than a lot of like even collegiate settings. Like that was one of my
Yeah.
bigger frustrations of being in the collegiate setting. It's like you theoretically have all of these people that are working together to help the athletes, but it can get compartmentalized very quick. So that integration between all of that, I think, is really really interesting. So then, what are with some of these basketball guys and stuff like that? What are some of the biggest things that they're running into in your wheelhouse in terms of injuries, in terms of big stuff, in terms of little stuff? Like, what are you kind of dealing with, helping these guys with more than anything else?
So the big thing is patella tendonitis. That's basketball. It's jumper's knee. That's the biggest thing. Really, what I've been dealing with through the whole year, basically, with a lot of the guys. A lot of ankle sprains. Um, I want to say I had. So we have about in our CBD program, we have about 150 boys. I want to say I had at least 25 isolated ankle sprains. So that's like 25 guys had ankle sprains at some point this year. They may have had two, unfortunately. I can think of off the top of my head, I can think of at least two kids who had both ankles sprained throughout the year. And what I've noticed is, like I was saying, with the ankle mobility, a lot of the time when the kids don't have the dorsiflexion, they sprain their ankle. And then another thing is what I'm running into is hip mobility. If their hips aren't mobile, then they're stiff, and then kind of either their knee or their ankle is going to have to compensate for that lack of mobility in their hip. Um, and what I've just noticed, there's a lot of lack of hip mobility and then that ankle. Um, with the ones that had the knee injuries, the jumper's knee, same thing. It's mostly with the jumper's knee, I've noticed, is with the dorsiflexion.
Mm. God, so with both of those, like the patellar tendonitis and the ankle sprains, like that mobility through the ankle, like seeing a lot of the guys that are popping up with these sort of injuries, like when you're taking a peek at their ankles and stuff like that, thing's pretty stiff, thing doesn't want to move.
Yep, yep, exactly. I think I noticed with I think I saw you post the other day about it, tendon stiffness in the lower leg.
Yeah, with the
I've been starting to do a lot more of that with I don't know if you've heard of oh my goodness, I'm blanking out. Oh, sprained ankle,
yeah,
sprained
that's where I got
ankle
that's
isometric.
exactly what I was doing. That's where I got that from.
Yeah, yeah, I've been doing a lot of sprained ankle with them. I kind of build up to it. I've been doing some other stuff before I build up to that. I've been doing a lot of foot intrinsic muscle strengthening, kind of
Also,
just see how that reacts. Um, your basic stuff like towel scrunches, stuff like that, just with getting those toes to work. Because just one isolated incident, one kid, his big toe would not move at all, and he kept spraining his ankle. Like had to be 6 times this year. Had to be.
yeah.
Yeah. So if that toe doesn't move, sometimes it because of the muscles that lead up into the ankle, they can sprain their ankle just because it's stiff also. So
Definitely heard Cal and Chris like Corfus talking about that a lot of like just the ability to like both passively or actively like move that toe and then how it's just
mhm.
everything's connected, right? So if that's like the farthest thing downstream of if that one's messed up, something upstream is gonna run
Yep,
into
exactly.
issues as well. So then with these guys, when like I guess maybe before and after, so like what are you trying to do with them to get them back? Like I imagine you're trying to work on getting those ankles to move and that sort of thing. Like what kind of stuff are you doing for that?
Do a lot of active mobility with them because I like to educate them and let them know, like, hey, like you have an AAU tournament where you're gonna have, like, for instance, I'm sure there's 4 games this weekend. You're gonna have 4 games. I'm not gonna be there. So what are you gonna do to make sure you're good to go for that game? Here's some things you can do. This is what we're gonna do with me. Here's things you can do on the weekend so that hopefully you can lessen the chance of rolling your ankle or at least get yourself ready. And then it's usually like 2 or 3 exercises just to show them real quick, just quick, because they have their warm up. They'll forget about it or they'll forget something, and then hopefully they're ready for the game. Hopefully they do a few. It's also makes it easy for them to remember. And then they come back on Monday, and then we'll see. Hopefully no ankle sprain. Cool. We keep building. We if we rolled our ankle maybe, or if we had a tweak or something, or maybe something doesn't feel right. Okay, maybe we'll regress a little bit, and then we'll build up later on.
Gotcha. It is always interesting, right? Like giving them as much stuff as we can, like as much stuff for them to do to help, but also making it something that's as simple and as digestible as possible. So it is a lot of times
Yeah,
I try to find that balance between the two. There's 15 things you probably should do, but what are the one or two that if I tell you to do, you actually will do? So that's always a fun one from like a coach's perspective or a practitioner's perspective. With the ankle stuff specifically, like you hear a lot of people talk about like ankle sprains being bad because of their like tendency to kind of linger. Like they won't necessarily like they're very challenging to like resolve themselves. So, like for me, I ended up breaking my ankle and it was a very long process, not a lot of fun, but like once it was finally resolved, of like it was resolved. It's not something that's like I've kind of continued to have issues with. Versus you kind of hear the opposite of that with sprains and that sort of thing, is things will linger, it increases your chances of doing it again, all of this stuff. Is that something that you see, and then what kind of stuff are you trying to do to like kind of mitigate that, like when somebody is coming back from a sprain?
So yeah, it is definitely something I see. The big thing is the healing time. Um, these kids, just in general, it's I understand. I sprained my ankle. I had a grade 2 ankle sprain when I played football. I might have been out maybe a week, and then I went back. I get it. You want to play, right? You want to play your sport. Um, and my job as athletic trainer, the medical, like I always say, the primary medical provider for these kids is to educate them and let them know, like, hey, like you could go play. You could go play. I don't doubt you can play. But do you want this to come out again and again and again and again and again? Or do you want to resolve it and then let's go? Let's, we're good to go. Like we're out 2 weeks, we're out, a month, say, and then bam, we're not going to have to worry about this again because we took care of it and we allowed our body to heal. We gave that ligament the time to heal properly. And then also, hey, you got to keep doing it though. Like you got to keep working on your mobility because, you keep working these muscles, everything tightens up again at some point, or you keep doing what you're doing and everything tightens up again. And then bam, another ankle sprain, or maybe it's the other ankle. Just biggest thing is education. Um, but also putting yourself in the shoes of the kid because at some point we were all 14, 15-year-old boy that wanted to just play basketball or play our sport, whatever it may be. Um, and just educating them like, hey, you have like, for instance, we also have post grads. I didn't mention that, which are usually that gap year. Some kids are 19. We've had a 20-year-old, I think, just by with the birthday. But just taking that into account too, they're young men. And just, hey, they're trying to get a scholarship to whatever school it may be. They just want to go to college for free. They want to play basketball. And just educating them like, hey, you could go try out for the school, but your ankle's bad. And do you want to give them a rap? Like, do you want to give them a bad interview, basically? Or do you want to get healthy and then do your best? And then bam, you got a full ride to your dream school.
Yeah.
So biggest thing is educating and just educating, really.
Yeah.
Letting them know like your reasoning also, always being transparent with the kids.
Yeah, a lot of times, especially with these like these higher level guys, it does seem like from our end, we're doing a lot of kind of like trying to rein them in rather than trying to push them. And so a lot of that like kind of protecting them from themselves, that kind of thing. So just being straight up about like having a conversation of look, like you can, but we're running the risk of doing this down the road. So it sounds like if we're comparing like mobility versus strength versus more like kind of tendon work, elasticity, like you're really hitting that mobility side of things hard when it comes to the ankle stuff, both as like kind of pre and post for some of the ankle sprains. Is that probably your biggest area of like kind of focus and stuff like that that you're hitting when it comes to the ankles?
Yeah, I always start with mobility. Once we get the mobility, then I start working on the strengthening. Um, Biggest thing, if they can't move in the proper range, then there's no point to start to strengthen it. You know, you're not helping it out if it can move into the exact range. Like I said, with these big 6'9" guys, it's really hard for them to get down to a full squat.
Yeah.
And that starts from the hips, ankles, sometimes a low back, depending on the guy. But big thing is just getting that mobility because if you can get the guy down into it, cool, then you can load it. You get a guy down to, a 6'10" guy. I'm 5'9". I'm not 6'10". It's easy for me to get down to a squat, but you add a whole foot and then you try to get down to that whole squat. They might not be able to do it. Once they get that mobility, then they can do it. Let's do a goblet squat with a kettlebell. Okay, good. Now let's start strengthening because now you were never able to get down to that before. What are you going to be able to do now physically with your natural talent add the strength training, add mobility, add all of it, all the sports performance stuff. What are you going to be able to do now with more, basically?
Yeah, more access to ranges that you can move in, more access to opportunities to be strong, to be explosive, everything like that. So like, yeah, makes a lot of sense. Like with the jumpers knee, then more of that like patella tendonitis. Like I know you talked about like again coming at that mobility perspective first for like the ankle, but then also the hip when it comes to the knee. Any other stuff you're doing for that? Like what are some of your big rocks there? Are you looking at stuff specifically for that patella tendon, or are we doing more stuff above and below trying to get things to move?
I like how you said that. So I do a little of both. So I like to do a lot of isometrics. I got to do isometrics with the patella tendon. I also like to do a lot of eccentrics. Um, Once they are able to handle eccentric, uh, usually when they get that ankle range of motion, I like to get them into eccentrics because then that's really just stressing that tendon, and then usually they feel better. Um, and then something which I haven't done a lot this year. Now that I think about it, is landing mechanics. A lot of these guys, we had a guy last year on our varsity team, played Division 1, but jumped out of the gym. This kid had to jump 44 inches, had to be jumped out of the gym, um, but he could not land. His knees killed him, and my knees always hurt. My knees always hurt. My knees always hurt. Looked at his landing mechanics, landed like straight leg the entire time. So a lot of the thing that I did with him was working on learning how to land. I was like, hey man, you can't land just straight leg. He's like, well, why not? I've always done that. It's like, well, that's why your knees hurt. So you got to be able to dissipate that weight, drop down low when you land. And he's like, oh, I feel better. And I was like, yeah, that's how you're supposed to land. You're not supposed to put all that stress, all that pressure into your knees. The force coming down, you jump in 44 inches and then you're coming straight down, you're putting all that force through your knees. No wonder your knees hurt. If you drop down, you bend your knees a little bit, you land a little softer, it's going to dissipate that force, and then you're not going to have that knee pain anymore. So eventually his knee pain went away. It was a struggle to get him to learn how to land properly. He was a fairly tall kid, real lanky. What I did was just like a little short box. It had to be like 3-inch box, and he couldn't even do that, like bend his knee on that, like to land. We got it worked up, but it was just funny to see how like straight leg he landed.
Was he like a very, in terms of like his jumping, was he one of those like very quick off the ground, like the
Oh
very
yeah.
type versus that big like force type? Like
Oh yeah.
it's very, very interesting. Like, okay.
We call him pogo stick. We said he had a pogo stick because like someone would miss a shot, he'd jump up and get the rebound and dunk it at the same time. It's like, and then even if he didn't dunk it, let's say he shot a layup and missed it, he would be back up again before the ball even closely came off the rim. Kid was pogo stick, like fast twitch, definition of fast twitch.
That's funny. Do you see a lot of like kind of differences between guys in terms of that more maybe like force dominant like Zion who can still like hop but like is very like more like powerful versus more of those guys that are that very kind of springy, that like gazelle type like this kid? Do you see a lot of both of those, or do you see more of an emphasis of like one versus the other with a lot of these basketball guys?
I would say it's more mixed. No, think about it. We didn't have any from our varsity top level that I can think of. We didn't really have that pogo stick this year that I can think of. But we have the powerful, we have the springy guys, like, but I can't think of like a single one right now. Like it's a little more of a mix.
Yeah, yeah, that's interesting. I just didn't know like if as you go up to like, because again you see some of these guys that are very, very high level, if there was a tendency towards one or the other. So that is kind of interesting that it's a little bit more like 50-50, just because you'll see like in
Mm,
more of the performance worlds, like that's that like fascia side of things versus like the traditional strength and power side of things is like becoming like a very big debate of like which one's better and all that stuff. So it's interesting to see that you'll see guys at a higher level that will use both of those strategies. It's not maybe like skewed towards one. So that's interesting. Within the injury side of things, then again, so we talked about the like the kind of the ankle sprains and the patella tendon is like that jumper's knee, that patella tendonitis as being those two kind of biggies that you'll see in terms of like frequency and stuff like that. Do you, in terms of more like acute stuff, I guess the ankle sprain would be much more acute, but in terms of like knees and stuff like that, are you getting lots of guys coming off of ACLs and that sort of stuff, or not too many?
So last year we had a lot of those. We had about 20 overall, but not in basketball, just overall as a school.
Oh, okay, okay.
Uh, but we haven't had, knock on wood, a lot this year. We've had a few this year. Basketball, we haven't had any. Again, knock on wood. Um, but it's more of the preventative stuff. Our strength staff does a lot of preventative work. They do a lot of. Actually, our head athletic trainer used to be or I'm sorry, head strength coach used to be a head athletic trainer at one point. He went to school to be an athletic trainer. I think he did it for maybe 3 years, and then he was like, "Yeah, this isn't for me." Um, but he enjoys the preventative work. He does a lot of the preventative work, uh, like warm ups. He's big on warm ups and stuff before lifts. His thing is always I try to keep them in my room so they don't have to go in you guys' room, um, which is nice. Um, but we haven't really had a lot that I could think of this year. We don't have any in basketball, which is a good thing. I
Yeah.
actually love working with ACLs, but if I don't have to work with them, that's an even better sign.
Sure, for sure. Yeah, that's awesome. I mean, especially like to cut it down that much from the year prior. That sounds like a big drop. Like, do you think that's maybe just like partly just new year, just that's the way the season is going? But do you think like were they doing the same like preventative stuff last year, or is this something that's been a little bit newer that they're maybe seeing the fruits of?
So I think last year was more. I don't think it was anything related to anything we did, honestly. I think last year was more of the COVID related,
Uh,
um, because so you figure all these kids were locked up. We were locked up at home, and then so last year was 2022. So first year back, some countries. The thing is, we have 96 countries, right? So some countries are still locked down. Um, and then also a lot of kids came in with them. We had a bunch of kids who had torn their ACL in the summer or something playing. So again, that's an inactivity I think from COVID.
yeah.
Um, a lot a lot COVID, and then I really think it was just the inactivity, honestly. Kids maybe just playing the sport for the first time in 2 years, or kids might have not done anything when they were back home. Um, again, 2 years off, a year off, no strength training, maybe. Just another thing. Uh, yeah, I really think it was more COVID related because of the inactivity. It was also a weird time where a lot of them were, I would say, probably 15 to 16. So that, that middle of the high school year. Um, Maybe they were growing, maybe there's other factors. So it's a lot of things.
Yeah,
I really think it was more that inactivity, though.
that makes a lot of sense. So it's not so much that like you've cut things down a ton this year. It's more that the year before was just abnormally high, most likely
Yep.
from that makes a lot of sense. Like, okay. When it comes to some of the ACL stuff, 'cause I mean, you do said that's something that you enjoy working with. That's the stuff that I work with a lot of as well. Like, what are some of your kind of big rocks that you're looking for when it comes to the rehab recovery process?
Uh, so it just depends on like the point where they are in since surgery. Um, my rocks are probably a lot of single leg work, uh, eccentrics, double leg eccentrics. When I was a graduate assistant, one of my professors did research on eccentric with ACLs, and it just showed a very high likelihood that you won't re-tear. Um, I, I guess that's because of the tendon, and then also strengthening the muscles in that way. A lot of
Eccentrics,
time is what
like specific movement or like just eccentrics in general?
it was quad eccentrics.
But like on like a leg extension, like a squat, like
So I think one of the studies that he did was on the leg press, but eccentrics, single leg, and then some of it was squatting. It was like a split squat where you single leg down but double leg up.
okay.
Uh, so putting that stress on that one leg and then helping it up so it doesn't have to contract. Uh, and I lost my train of thought.
All right.
So a lot of split squat stuff, a lot of lower leg stuff. Doing a lot more like the tib raises. I like doing a lot of soleus work too, um, and then a lot of glute work, a lot of glute medius work, just to strengthen those. Weak hips sometimes will lead to an ACL tear, from what research shows. and just stuff like that. Let me think what else. A lot of single leg work. I've gotten more into single leg work. Um, yeah, a lot of that. Make sure they're mobile. Like I always said, ankles. Make sure those ankles are mobile.
You talked about depending on where they're at in the timeline, are you getting them from day 0 to like month 9, or are you getting them like somewhere in between?
So yeah, we see them first day out, and then we see them hopefully when they go back to sport. Obviously, summer throws that off. If it's a day student, we have day students and we have boarders, right? So we have boarders who live on campus, so we'll see them every single day. Day students are a little different because maybe they may leave. We might see them Monday, Wednesday, Friday, or something like that. And then they are going to PT on Tuesday and Thursday. So it's a little handoff to the PT and then handoff back. And then also sometimes the boarders stay on campus over summer, depending on the situation. Depends on where they're from. But if it's a day student, then they're gone for the summer. We won't see them. So it might be come August, it might be, hey, I'm cleared. Like, cool, but I have no idea what you look like. Like last I knew you couldn't run straight. Now it's August and you want to go play in a soccer game. So then we have some protocols in place where we kind of test kids one strength and then we test them agility, all sorts of sports performance tests basically, just to kind of see where they are. And then we correlate with our coaches, um, just to say, hey, like we think he needs like 2 more weeks. Okay, let the parents know, hey, we think 2 more weeks. Okay, that's fine. Kind of work with that and say, let's work with them for 2 weeks, see how you work and retest in 2 weeks, maybe retest in a month. Okay, you're good to go. We feel comfortable about you going back to sport.
That's awesome. Like I am very interested in that dynamic, that relationship between like the physical therapy when you like that's something that's not necessarily in-house. Like what does that look like for you guys? Do you guys have relationships of someone that like you know and trust and you're sending them to? Like how does that communication work? Like how do you guys make sure you're not stepping on toes? Like all of that stuff.
So for the boarding students, we have the National Training Center that they usually go to, which is not too far from Mount Verde National Training Center in Clearmont.
Hmm.
Um, they have physical therapists, and we're on either a text basis or we talk to our doctors also. Um, and then, like I said, with the boarders, or I'm sorry, the day students, it's a little harder because it may be that a surgeon from uh, Winter Park and they're not related to Mount Verde. You know, they go. It's more of a hey, parents, what's the contact? Hey, who do I need to contact? Hey, that kind of. Sometimes it's a little a rabbit chase, try to
Yeah.
figure out. But we just do our due diligence with reaching out and try to get a hold of them just to kind of see what we can get, the history, what they did, and just so we have more knowledge before we let a kid go back.
Gotcha. Yeah. Like, are you trying to? I'm sure there's like an interesting dynamic there, trying to balance out like maybe like who's taking lead, like if they're doing stuff, like to make sure you're not like doubling up, like with. I guess are there different scenarios where you guys are maybe trying to like emphasize it taking more of the point, or are you kind of just going off of what they're doing and then working around that? I guess it maybe depends on if they're doing stuff at the NTC where you guys have the relationship there versus working independently when you just kind of have to base off of whatever it is they're doing. But how do you kind of navigate that dynamic?
So, so we have a very good standing with our coaches. Our head athletic trainer, who's also an associate athletic director, Jason Torres. He's my director. Um, he's got a great relationship, and when he got hired back in 2017, and basically he's built that relationship with all the coaches. Where if we say a kid's not cleared, they're not cleared. The coaches respect that. Um, and that I think is a little different because that can be a little harder at a public school or wherever it may be. Some other schools may not. With just him being here so long and having that relationship, it makes it easy. Because I could say, hey, blah 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 is not cleared. He can't practice. Okay, what does he need to do? Does he need to be with you? Does he need to get paperwork? What does it may be? And so the coaches will respect our opinion if we say a kid's not out, and then they'll ask. They'll say why? Like, what do you see? It's like, well, he can't run. He's got a hitch. Like he has a hitch when he runs. Oh yeah, I did see that. When he walks, he has a hitch. Yeah, so his doctor cleared him or somebody cleared him, but we don't think it's best interest of the kid for him to train. Okay, good. Um, not ragging on anyone saying he's cleared without seeing that, but sometimes people get cleared and it's like, well, you there's a little lag. Your quad's smaller than the other one. I don't know if you should go back to play yet. It'll come back, but it puts you at more of a risk of a re-injury or another injury.
Yeah, a lot of times they're just going off of like a timeline versus maybe some of those like actual more objective measures. Like you touched on that before of like some of like a very kind of rigorous testing protocols and stuff like that that you'll put people through. What are some of those like KPIs you're looking for, some of those big tests that you're doing to kind of assess whether somebody is ready or not to go back?
So I usually do I compare bilaterally strength. It varies per athletic trainer, but we have like a bank that we go through, and then we kind of go through that. I add a little few different things. Um, Being with basketball, kind of like to see different things, like a single leg hop, just to see how they jump off of one leg, to see compared to the other leg. Obviously, in basketball, you depending on the guy, might jump off two legs, might jump off one, but it'd be nice to compare if they're more right leg dominant, left leg dominant. He tore his left ACL, but he's right leg dominant. So what's his left leg look like? Stuff like that. I like to see split squat just to see if they're bilateral. Unfortunately, we don't have any fancy like a biodex or anything that can really tell you if they're equal bilaterally. So I usually go the old, I like to say the meathead way, and I go split squats with dumbbells. I do single leg RDLs with dumbbells, and then oh man, I'm blanking out on my third one. I think that's it. I have to look at it, but I usually do split squat. No, I'm sorry, rear foot elevated split squat.
Yeah.
And then I'll do a single leg RDL, and then I usually do like a broad jump with single leg to see single leg verticals. We do a T test. What else do we do? I like to see how a guy moves laterally. So like if he's playing defense, I want to see how he's moving side to side. And then also how they run forward and then run backwards, kind of see how they're back trotting.
Gotcha. Very cool. And then like I guess from as they're starting to like pass some of these, starting to look like within acceptable ranges, starting to maybe like kind of reintegrate with team training rather than just kind of throwing them back in, but like, hey, go do a warm up, then do this technical stuff. Then
Yep.
gotcha. Gotcha. Like, okay, very cool. What's the kind of like timeline that you typically look at with some of these guys?
For ACL.
Yeah.
So it just depends on the situation. Also with doctor clearance and also kind of time of year. Um, when I worked in college, and I always say this, and people are like, "There's no way," but obviously every situation is different. But I had a girl who, when I worked softball, she tore ACL. She was back in 3 months, but what she did was she was DHing,
What is
and
that?
so DHing. So she was just hitting in softball. That's it. She wasn't playing the field, anything. She had torn her ACL. Very, very strong girl. She had been doing a lot of prehab before and then going into surgery. That's another thing that people don't take into account is
Yeah, I was
the
gonna ask.
strength. Yeah, strength going into rehab or going into surgery um, usually leads to a better outcome. So she DH'd. She DH'd and all she had to do was run to first, and then once she got to first, she's out. Like they're not letting her run anymore. Um, Different situation. Obviously, basketball is way different. Football is way different. You can get hit in football, like all sorts of different things. Soccer is different. Baseball is even different. Um, just all different things. It just depends really on the situation and depending on the sport. Soccer usually I would say is a little longer because you can get kicked, you can get slide tackled. You're running the whole time. There's the endurance standpoint. A soccer game's a lot longer usually than a basketball game. Basketball is usually just straight line back and forth. Sometimes you had to change a direction depending on how much they want to play defense. Um, and then another thing is it's nice to kind of integrate kids into practice with ACLs. Is like, for instance, we use offense only, so they are dictating where they're going, while on defense they have to react to what the ball handler's doing. So that's a nice little integration that we do. And it depends. I've seen kids play with a torn ACL. I mean, working in the college setting, you see that every once in a while, depending on the sport. Um, it's a healthcare thing, right? The kid gets to decide. Obviously, we don't want them to play with a torn ACL, But it just depends. I've seen a 2-year ACL, just because the athlete had it at a young age. Athlete had it at like 14, and
Wow.
so their parents wanted them to take a very long time, make sure that they were ready. It might have actually not been a good thing because they waited so long, but it just all depends. A lot of
Yeah.
research says 2 years, but are you going to really hold out a kid for 2 years when they're already missed a year because of their ACL and they want to go Division 1, they want to play professionally, whatever it may be. So
Yeah.
it's a lot of factors, and it's I don't know if there's an exact answer, but it's just dependent on the person and the scenario.
Yeah, yeah, definitely. I was just curious on kind of ballpark, and I will see a lot of that myself too, of like athletes that will come in, like they'll be on different timelines. So some will come in with like having like a date circled on the calendar of like I got to play for this, and you're like, ah, we'll see
Yeah.
what you know, like. But yeah, versus some you can kind of take your time, like I just want to be ready, like all of that stuff. I do want to be mindful of your time, but you did touch on the prehab side of things. That's one thing that I'm interested in as well. That yeah, I don't think people do enough of. It definitely seems like it makes a very, very big difference in terms of outcomes. I'm curious though, how different does your prehab look like in your mind to like immediately like post-op? So if we have like day zero is surgery, like 3 months or 3 week out from prehab versus 3 weeks out like post-op, like at same timelines, do those look fairly similar? Like, are you doing same kind of things or are those looking somewhat different?
Uh, Dependent. So, I've had athletes where they're really weak going into surgery. So you're gonna do a lot of reps. You're not gonna do a lot of weight because they're not strong enough. Then you have the kid who you would have never thought he had a torn ACL because he's so strong. It's just his knee gives out every once in a while. So that kid you might just keep pounding, keep up in him strong. Um, the reps aren't going to do anything. Like he's just sitting there. He's doing 30, but you told him to do 10, and he's like, "Is there more I can do?" It's like, okay, maybe we'll change more to a strength component. Um, and then you have, maybe the kid who this is his second year playing soccer, has never strength trained ever, and he can't even lift his legs straight up without pain, or he can't lift his legs straight up. In that situation, you want to do more endurance, you want to do more reps. And then also, now that we have the BFR, that's where I think that's going to play a good component with kids like that, because you can just have them do the BFR and do body weight. I love BFR. I've always used it in my rehabs previous to Mount Verde. But just it just depends. Post op, it's always going to be high reps, no matter what, no matter how strong the kid is. You don't want to load up a kid. 3 weeks post op, you don't want a kid to be trying to squat. They won't be cleared, and the ligament has not even enough time to heal at that point. So the big thing is just knowing the situation pre op, and then post op is taking into account that ligament healing time, and then also the physician's request or protocol. Um, and then, like I said, like knowing that experience, like you want to keep that you want to keep the reps high, weight down. You don't want to put extra stress on the ACL, on that new ligament that's there healing. Um, God forbid you do something where it's a re-tear or a complication of some sort.
Yeah, yeah. Okay, last thing for real, I'll do it because the BFR is something that I've dabbled in a little bit that I do think is very, very interesting. That's starting to become a little bit more mainstream. Like, how are you using that? Like maybe like timelines in terms of post-op as well as some of like the protocols.
So the protocol that I like is the 30, 15, 15, 15.
Yeah.
So
Okay.
it's 30 reps, 15, 15, 15, 3 sets. And then what I've learned in the past, what I've learned from mentors, what I've learned from research is you do for lower body, it's about 40 to 70% occluded. Um, and then upper body is usually like 20 to 40. Um, and you just kind of work from there. It just depends on if you want to do a hard day or you want to do a light day. If I want to do a flush, like a kid, just a recovery day, like we've had kids who, hey, I'm sore from, we had a tournament this weekend. Um, I'm sore. Could I do the BFR? Yeah. So it's more of that lower level, that lower threshold. and then tell them to do the reps, and just to get that blood flow flowing to get them to recover. What's nice is we've had some kids that have come in now. We just got it this year. And what was nice is kids started to notice like, oh, this feels good. Like this is better than doing like the recovery boost or like a cold tub. This feels better. It's like, oh, okay, so the wheels turning. Like you don't just jump in a cold tub. You don't just jump in the boots and then bam. You don't get the massage gun, right? And just sit there and do that. You can actually do stuff actively to feel better than just sitting there. Like, don't get me wrong, sitting there on the Normatec feels great.
Yeah, it feels awesome.
But yeah, but there's other things you can do to recover and also to improve that recovery. Getting that blood flow, just that natural blood flow there. And then your other question with you said
Time,
protocol and then
how soon are you
timeline.
using it? Like how late into it versus are you getting into how late are you getting rid of it?
Ooh, how early? I would probably say a month. The big thing is if a kid had any complications, venous complications. If they have anything like that, you don't even want to touch them with the BFR. But if they don't have any complications, I usually say about a month. And then I usually do it either. It depends. It depends on the kid. Kind of depends on how they're doing in rehab. Either once or twice a week, and then I do it for about a month, and then I kind of relax on it. And then when they're later in the rehab and they're like, let's say they're in the return to play phase, they're doing more, agilities and stuff like that. I'll throw it in there once a week as a strength training day. And it's like, hey, we're doing the BFR. We're going to do real lightweight, but you're going to do the reps. And then that's it. Like that's your rehab, but then you're going to run. So I'll throw it in there later on. And then I'll throw it in like relatively early on. Early on because it'll help that muscle grow, that quad, especially with an ACL, get that quad to really get swollen up, and then get the blood flow there. You always see with ACLs that quad just shrinks. Looks like they've never done a leg day ever. So the big thing is just getting that blood flow in there and just getting that firing, and then kind of like give them a break for like a month. Let them like, oh, some kids. I will say that some kids love it. Some kids do not love it. Some kids dread it. I have a fun thing that I do. Well, it's fun for me. Sometimes it's not fun for the patient, but they enjoy it after. Is they do the BFR, usually a low occlusion, and then I have them just go walk. You're gonna go walk for 20 minutes. Bye. See you in 20 minutes, and then come back, and then just to get that flush going on.
That's awesome. That's awesome. Like, all right. Well, thank you very much for your time today, Chris. This has been awesome. So very much love all the stuff that you're doing over there, and so appreciate getting the time to kind of connect, get to know you, get to pick your brain a little bit. Where can people find you if they want to learn more about you specifically, and then all of the fun things you're doing at Monte Verde?
You can find me on my Instagram at williamsrehab.com or at williamsrehab_Williams rehab. And they can find me there.
Beautiful. Thank you so much, man. Look forward to having you on again soon.
No problem. Thank you.
Absolutely.